So coming from the left side, there's a spur, so I obviously am not in the best position to reach over there. But that's the coena. I'm just coagulating these small vessels and removing the superior boundary adenoids completely, and that's the fossa Rosenmuller going behind. So if it was not possible for me to see all this, I would have taken a 70 degree and came from the would have come from the oral cavity. But since I'm able to see it completely over here, so I'm using a 0 degree through the nose. So this gives a much better perspective. So the fossa Rosenmuller is clear. This is a little amount of tissue on the torus tuberous and the area behind. I'll be very careful. That's the buccopharyngeal fascia. Little bit of tissue at the lower part. You understand my vision is compromised on this side. Therefore, I can only go till the part I can clearly see. My scope cannot bend here. Okay. So now I'll go in from the right hand side, or maybe just check from the oral side that everything is done. There's a very little amount of tissue here which I'll coagulate. I'll not try to ablate it on the sides. I will only coagulate so that it will fibrose. Right now I'm just using a 0 degree which is in my hand. I can always take a 70 degree and go there. But since the upper part is completely done, I'm able to see the lower part. This is the coagulation of the tubal tonsils. There's a little bit of tissue here, but far laterally you do not need to remove every bit. You can just coagulate and leave it. Now, this is the central pit that we are talking about. Again, only coagulation inside the central pit. Do not try to go deep inside. The adenoid is almost completely removed, and that's the end of the surgery. See, I can remove this part. I'm ablating very carefully because we are pretty lateral, and that's where you can get some bleeding. So far laterally, it's prudent to only coagulate. So that's what I'm doing. Thank you for watching. I'll just show you the boundaries once again from the right nostril. If your scope is fogged, you can simply go and touch the tissues so that the scope is cleared. Sometimes, if required, we can use a wash. One sec. Hold on. So these are the boundaries of the adenoid surgery. Superiorly, the periosteum below the sphenoid bone, very clearly defined. Laterally, anteriorly the torus tuberous, and posteriorly the fossa of Rosenmuller. Whatever is left out there, small bits you can coagulate. There is no need to open up the fascia for removal of every small bit. Once you coagulate, it will fibrose. But it's all important to remove the major part of it. Posteriorly, it's the buccopharyngeal fascia. You can see it very clearly. I have not opened it. Inferiorly, it's the Passavant's ridge. and same thing on the left hand side. So thank you for watching.